Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 12-year-old patient is being seen today in follow-up after being started on fluoxetine 1 month ago for a diagnosis of generalized anxiety disorder. The patient and her father both report that while there does appear to be a mild improvement in anxiety, some adverse effects have developed about which they are concerned. Which of the following is not an expected adverse effect and is a cause for concern? A. Vivid nightmares. B. Diaphoresis. C. Restless legs. D. Impulsivity. So this is clearly an evaluation question here. An intervention has been implemented. The patient returns for follow-up, and you are evaluating the response to that intervention. So, okay, there has been some mild symptom improvement, but they're concerned about adverse effects. And you know how this goes. Adverse effects are unfortunately rather common early in therapy. And so you definitely want to be able to differentiate the normal, expected, non-concerning adverse effects that require primarily reassurance. Sometimes perhaps you lower the dose a little bit, but primarily it's about reassurance. And other times there are adverse effects that really should raise the red flag for you, and you know that it's time to stop this medication. So in the setting of fluoxetine for a 12-year-old, which one of these is a cause for concern? And the answer is D, impulsivity. Fluoxetine, aka Prozac, but of course now there's a whole bunch of generics and probably other branded names. Fluoxetine is typically very well tolerated in adolescents, and it's the oldest SSRI. It's the one we have the most experience with. It's one of the few that actually is FDA indicated for adolescents. We know a lot about it, and we know a lot about what to expect. And there are some commonly encountered adverse effects, and they usually are short-lived, and they are not a cause for concern. The primary intervention is reassuring the patient and the family. Things like changes in appetite, gastrointestinal symptoms, whether it's, abdominal discomfort, constipation, diarrhea, mild nausea, it kind of runs the gamut. Headache is another one, very common with any SSRI early on. Sleep changes. Sometimes people will say it makes them tired. Other times they can't sleep. Other times they wake up tired, they go to bed, their brain is racing. None of this is unusual. And even a general sense of restlessness or even restless legs are not particularly a cause of concern. That, a sense of transient fatigue, none of these are unusual, and they usually can be managed with reassurance or sometimes even short-term over-the-counter symptom management like, something like acetaminophen for the headache. And remember, fluoxetine, as the very first SSRI on the market, is the one with the most pronounced adverse effect profile. The vast majority of them are not a cause for concern, but you do see more adverse effects with fluoxetine than any of the other newer SSRIs. That's just the nature of the beast of any first drug available in a new class. But again, most of them, in my experience, in 99 out of 100 worlds, at the first month follow-up, people will complain of some of these adverse effects. If you can reassure them, if you can just keep them engaged and ask them to give it one more month, usually at month 2, the adverse effects are, if they're still there at all, they're much more minimal, and the clinical efficacy is more obvious, and they're glad that they stuck with it. However, impulsivity is not a typical adverse effect of fluoxetine. And really, it should prompt consideration for an undiagnosed bipolar disorder. It really can, not just fluoxetine, but any SSRI, when it's administered to someone with an undiagnosed bipolar disorder, can precipitate a manic episode. So impulsivity is a concern. Vivid nightmares, diaphoresis, any of this stuff. Nightmares, can't sleep well, sleep too much, tired all the time, tired all day, whatever. Diaphoresis is, oddly more common than you might expect in the beginning. Restless legs, restlessness, okay, all of them you may expect to see. But when you're hearing about impulsivity, remember, patients don't usually come in and say, yes, I am suddenly much more impulsive. But when you hear things like, oh, I'm getting mad for no reason. Like I just get so mad and I can't stop myself. I throw things, I break things, I don't know, punch the table. I say things I wish I hadn't said. I blurt stuff out. I'm doing things I usually wouldn't do, like, spend money I don't have or whatever. When you get symptoms of impulsivity, that is not an anticipated adverse effect, and it is a cause for, at the very least, serious exploration.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.